Hey everybody, this is Jessica again, and this presentation will be covering full body versus focused assessments. Before we get started, let's go over what this presentation is and isn't about. This presentation is about the differences between assessment types and when to use each. It is not a step-by-step guide to completing an assessment. So what is an assessment? Assessments are key to nursing practice and the care of the patient. They are all about gathering information regarding the patient's individual, physiological, sociological, and spiritual needs through interview and physical assessment. There are three common assessment types. The first is admission assessment. This is a type of full body assessment. It includes a comprehensive nursing assessment of the patient history, general appearance, physical examination, and vital signs. Next is a shift assessment. This is a more concise full body and/or focused assessment than the admission assessment. It is done at the beginning of each shift or if the patient's condition changes during that shift. Finally, there's the focused assessment. This is a detailed nursing assessment. It assesses a specific body system or systems that is the presenting problem or concern of that patient. Here are some general assessment tips. Consider the age and developmental stage when you're going to start an assessment. Be respectful and culturally appropriate to not just the patient but also their family members. And always introduce yourself at the beginning of the assessment. When doing an assessment, use a systemic approach but be flexible to the patient preference. Encourage the patient or family member to ask questions and voice any concerns. And cluster assessments during your shift when possible. However, always weigh the clinical need for an assessment with the patient's need to rest. Finally, if at any point in the assessment process there is a serious concern, make sure to relay that concern to the appropriate medical team as soon as possible. Now let's go back to the assessment types. The first is the admission assessment, and the first step in that assessment is patient history, which is done by interview. During patient history, you should gather a history of the presenting problem, the medications they're on, any recent overseas travel, their allergies and any reactions to those allergies, relevant past history, their family and social history, and their immunization status. The next step in the admission assessment is your general assessment. This includes the patient's overall physical, emotional, and behavioral state. How does the patient look? Do they look well or unwell, pale or flushed, lethargic or active, agitated or calm? Are they compliant or combative? How is their posture and their movement? Additional measurements you can get at this time are vital signs, weight, and height. The final step in the admission assessment is a physical assessment. This is where you do your thorough physical assessment. Admission assessment should always be a full body assessment. The next assessment type is the shift assessment. Let's start with an overview. The shift assessment is done at the beginning of each shift. It's completed on every patient in your care and helps you to plan your care for that patient during your shift. It is documented in patient care plans and flow sheets. Any changes to the initial assessment should also be documented. Nursing judgment should decide on the extent of the assessment. The shift assessment can be either a full body assessment or a focused assessment. When starting your shift assessment, you should do a general assessment. This is similar to the general assessment you would have done in the admission assessment. You should include airway, breathing, and circulation. A disability assessment, such as any disability with movement. Do they have any problems swallowing? Do they need hearing aids or dentures? How is their hydration and nutrition status? How is their input and output? And what type of risk level are they? Are they at risk for aspiration? At risk for fall? The next step is your physical assessment. Here, you do a full or focused physical assessment of systems. Speaking of focused assessments, let's focus on that. A focused assessment can be done during your shift assessment or at any point during the care of your patient. It should focus on one or more systems, and your nursing judgment determines which systems. If you're doing a neurological assessment, you should look at your observations. What is their level of consciousness, their pupil size, their movements? any information on seizures if applicable, their growth and development, their sensory functions. If doing a respiratory assessment, know the history. Do an inspection or observation, auscultation, and palpation. If doing a cardiovascular assessment, make sure you inspect, you palpate, and you auscultate. If doing a gastrointestinal assessment, get the history, do an inspection, palpate, and auscultate. Doing a renal assessment, look at their urinary patterns. How frequent are they going? Their hydration, their skin, their diet, their output, and any pertinent labs. If you're doing a musculoskeletal assessment, do an inspection, a palpation, and also note any neurovascular observations that you might find during a musculoskeletal assessment. While this isn't a body system, sometimes you need to do an assessment of the eyes, ears, nose, and throat. If doing this, make sure you inspect or observe and palpate when necessary. Finally, if you're doing a skin assessment, make sure you inspect and observe and palpate. That's it. Thank you for listening to this presentation on full versus focused assessments. If you have any questions, please don't hesitate to reach out to me. Here is my email address and phone number.